another episode of PT in the Making. So today we're going to talk about ultrasound. So what is ultrasound? In a simplistic form, it's just sound energy into tissues. So you just use a machine to send sound waves into tissues, and that's going to help promote healing such as soft tissue, pain relief, and then you have different aspects of ultrasound. So you have the thermal versus non-thermal. For thermal, it's going to increase blood flow, increase tissue extensibility, increase muscle relaxation, and it'll decrease muscle spasms. That's what you'll get if you use the thermal effects of ultrasound. But if you use the non-thermal effects, you'll still get some benefits such as stimulating fibroblastic activity and modifying cell function. So these are the effects you'll get when using ultrasound. Keep in mind, these have not been researched, and there's not a lot of research supporting or contradicting them, but this is what they believe what it affects. All right, so how to use ultrasound. So this funky looking F just means frequency. So for ultrasound machines, you normally have 1, 2, and 3 megahertz. And so for megahertz, it's just the higher you go, the more superficial it gets, meaning it will not penetrate into deep tissue. So if you want to do deep penetration, hit deep tissues, you're going to have it on 1 megahertz. If you want more superficial, not trying to go too deep, then you'll stick to 3 megahertz. 2 is in the middle, so you normally want to stick around 3 or 1. And then here, once again, tissues with high protein or collagen will absorb heat faster, and so you'll want to keep that in mind whenever we go to our next topic, which is duty cycle, or DC. To keep it simple, duty cycle just means the period for ultrasound that the machine's on. So if you have a 20% duty cycle, it means for that allotted time, 20% of the time it's going to be on. If you go to 50%, 50% of the time it's going to be on, 50% of the time it's going to be off. And then 100%, it's constantly going. They sometimes label it as continuous on there. And that's where you'll get those thermal effects. It'll start warming up the tissue. But you do want to be careful when you reach that point, because you want to keep moving the ERA, or the effective radiating area, head around. Otherwise, you can burn a patient. So keep that moving, especially if you reach 100. And the patient can tell you, just ask the patient, is that hot? And if it's too hot or not, then you know to keep moving that ERA. All right, so for intensity, you normally have a range of 0.5 to 1.5. And so for this unit, it's going to be watts per centimeter squared. So that's the units we use for describing intensity. You want to start around 1.5. It's just a good baseline to start. And then if it gets too hot, or it starts becoming hot, especially when you're trying to achieve these non-thermal effects, you just decrease the intensity. If it's not hot enough, just increase the intensity, but go off what your patient says. And then the time, about 8 to 10 minutes. You can lower that or increase that, but you want to stick around 8 to 10 minutes when using ultrasound. All right, so going over here, we'll start with indications this time. So for indications on when to use ultrasound, you want to use it, especially if you're trying to help repair acute and chronic soft tissue dysfunction. That's especially, so if they have acute or chronic soft tissue impairments or soft tissue impairments, then you're going to want to use ultrasound. For the acute, you got to be careful. Once again, you cannot do the thermal effects, so you're aiming for those non-thermal effects again. So no heat when using it for acute. Another indication, pain, pretty simple. That's an indication for most modalities. Another one is muscular spasms. As we know, it can help with muscular spasms, especially with thermal. It can help with soft tissue and bone healing. And then it can even help with inflammation using phonophoresis. And last but not least is the contraindications. So for contraindications, we got our main ones. Once again, pregnancy, active cancer, impaired sensation, especially for thermal, you want to be careful of that. Open wound. And then for ultrasound, you also got to be careful of tuberculosis, if they're hemorrhagic, and then you don't want to use it over sensitive areas that don't have a lot of skin, such as over their eyes and neck. And that's it for ultrasound. So now we're going to look at a patient scenario on how to set up ultrasound and using ultrasound on a patient. So today I'm going to do ultrasound on Bonnie, who's a 26-year-old mother who was last pregnant 2 years ago, so no contraindications. And to set up my machine, I'm first going to put it for sound. And then for frequency, I'm going to set it to 3. Since it's superficial near her L5 vertebrae, I don't need to go that deep. I'm going to have it on continuous, that way she gets those thermal effects, because once again, she has no contraindications, and it is a chronic injury, not an acute injury. And then for intensity, I'm going to increase the intensity up to 1.5 to start with, and then I'm going to ask her how that feels. If it's too hot, I will decrease the intensity, and if she's not feeling any heat, then I will increase the intensity. Hi Bonnie, how are you today?
Good, how are you?
I'm good. So today what I want to try to do is try some ultrasound. And so what that is where we send sound waves into your body, and that's going to help the healing process. And with this ultrasound, we'll also get some heat in that area, which will even help the healing process even more. So would you be open to trying ultrasound today?
Yeah, absolutely.
All right, perfect. And then do you have any active cancer that you know about?
No.
Okay, any pregnancies lately, or any chance you could be pregnant at the moment?
I sure hope not.
Perfect. And then any impaired sensation in that area, you can still feel everything there?
Definitely can.
Okay, perfect. Just making sure. All right. So then the patient is prepped, and I applied towels just to help her feel comfortable and know what area I'm going to be working on. All right, so what I'm going to do is I'm going to put some gel on the area. It's just going to help with the ultrasound. It is going to be cold at first, so I do apologize,
Okay.
but we'll try and get it warmed up real quick. Turn on the machine. Alright, and then how does that feel?
Feels good.
Feel any heat yet, or?
Not yet.
Not yet. Alright, I'm just gonna increase the intensity a little bit. Alright, how about now?
Yeah, starting to
Okay,
feel it.
starting to feel some heat. Alright, I'm just gonna keep moving it and just keep doing this. Alright, so time is up. And so how'd that feel?
Felt good. Felt warm.
Felt warm? Nice. No burning or?
No.
Alright, and then the skin looks good. Looks like you got no burns, and so you are good to go.
Awesome. Thank you so much.
You're welcome.